going to talk about subcutaneous fluids today, or sub-Q fluids. A lot of times we teach our owners how to do this to their own pets. It may be because a cat has kidney disease or a dog has liver disease and isn't eating. We may do it in the hospital if your dog comes in dehydrated or your cat comes in dehydrated, but they're not quite sick enough to stay in the hospital. As opposed to humans, cats and dogs have a lot of subcutaneous space. If you try to do that on me, you're not going to get much, hopefully, at this stage in life. And so typically we'll have our technician show you how to put together the fluid bag, and it involves putting the IV line into the fluid bag. And if you're at home, you can put this bag on a hanger. It's got a little hole at the top, and you can put it on top of your door jamb or on exercise equipment that you aren't using or something like that. And then we'll teach you how to place the needle in your cat or in your dog. And you're placing it right under the skin. So if you lift the skin, if you try this at home, you almost feel a little triangle here. And you're aiming for the needle to be kind of parallel to his body, and it's going to end up below the skin. You can't do too much wrong with this. There are some kitties who let you do it without a problem. There are some dogs who are really good about it, and there's some cats and dogs who aren't particularly happy about it. So Emily will demonstrate the technique. I'll turn Ferd a little sideways here. And most cats will let you do this. If you get really talented, you may be able to do it all alone without someone holding your kitty. You have to be a little bit brave when you're poking them, because if you're really slow and gentle, it actually hurts more. For some cats, it's not so much the needle stick as it is getting that fluid going in. That fluid is room temperature, and of course a cat isn't room temperature, so sometimes they feel a little bit odd as the fluid goes in. But most learn to get used to it, and within a few minutes you can administer the amount of fluid that your doctor will tell you to give, either once or twice a day. Then you'll notice a lump. Oh, do you not like it? You'll notice a lump on top of the skin, and that will get absorbed over time. And Ferd is a young and healthy kitty, so he knows he doesn't need these fluids. But he's going to get a little bit anyway, so we can show you what to do. Now we'll pretend we've given him about 100 mils here, and then after you're done, you take the needle out. If there's a little drop or two of fluid that comes out, don't worry about that. It's no big deal. It'll just roll down his fur. And you'll feel a little cushy, lumpy area there, and that'll go away in time, depending on how quickly a kitty needs fluids. And most cats, even if they're upset, you start petting them again, and they'll forgive you for doing it. Some cats actually very much get used to it. Some of my owners trick them with treats, and dogs get used to it too. So it's an easy technique to use at home to either give a cat or dog a little extra fluid when they need it, or give them enough fluid so they can stay out of the hospital and they don't have to come in all the time. It may be something that your doctor's going to have you do for a day or two, or it may be something that's a lifelong thing. But most animals can get used to it, most people can get used to it, and if you can't, then there are other things we can do to help you and your pet.